What's up, y'all? It's Celeste. On January 5th, 2023, I had a bilateral salpingectomy, which is the medical term for fallopian tube removal for sterilization. So in this video, I just want to talk a little bit about why I chose to do that and kind of go through the process of pursuing it and the actual procedure and then the recovery and just kind of going through the whole journey, which has taken quite a while actually. Basically, like many other people, when Roe versus Wade was overturned, I started feeling very anxious about being a person with a uterus and not ever wanting to have children and feeling like the options were getting more and more limited, especially since I live in Florida, which is not particularly abortion friendly already. And it just is becoming more and more concerning about not just abortion itself, but options for birth control and the fact that currently birth control and sterilization procedures, etc., are covered under the Affordable Care Act, and that may not always be the case if certain political parties have their way. So I wanted to make sure I could get this done while it was still an option and just basically like for peace of mind. So if you've been following my channel for a while, you know that I identified as asexual for a very long time, and I actually stopped identifying kind of actively as asexual sometime last year. I posted about it on Instagram, but I don't think I ever mentioned it here. But nothing like functionally changed in my life. It's not like I had like a new relationship that changed things or anything like that. I just over time have kind of shifted the way I feel about things, and that's like a whole topic for another video, so I'm not going to go into that here. But the possibility of me being sexually active at some point became more possible, and just everything like that coupled with the Roe versus Wade thing, it just made me feel like I really wanted to get this done and just ensure that I never ever can get pregnant, because that's something that I really don't ever want to do. In addition to not wanting to have kids, I just the idea of being pregnant is absolutely horrifying to me. Nothing against people that want to be pregnant, good for you, but obviously it's important for the human race, but for me it's just not at all something that I could stand at all. Shortly after it was announced that Roe versus Wade was getting overturned, there was a spreadsheet going around the internet of providers that do sterilizations without making you jump through a bunch of extra hoops. And one of the columns in the spreadsheet was actually whether that provider is LGBTQ friendly. Not to say that the other ones aren't, but those specifically identify themselves that way or advertise themselves that way. There's also a trans and non-binary hysterectomy group on Facebook, hysterectomy and associated procedures. And I also found a directory of, I can't remember if it's just queer friendly. I can't even remember what the directory is, but it's some kind of directory of queer-friendly providers of stuff. I don't know if it's all medical or not. I'll have to look at it again. I'll put the link in the description. But on there, I found an OBGYN in the Orlando area who I thought would be a really good fit because she is actually a queer herself. But unfortunately, she doesn't take my insurance, so I couldn't go with her. Then through the Facebook group, I found another doctor, and I had a consultation with him last July. And my consultation was for both tubal ligation and hysterectomy, because I was interested in both. I was interested in finding out more about both. And he seemed okay. There wasn't anything bad about him necessarily, but I just didn't really get the best feeling. I had a lot of questions, and I felt like he was a little bit too nonchalant with the answers. He was a little bit too reassuring, which to me is a big red flag. It's not that I want the doctor to be panicking about anything, obviously. I want them to have confidence that they can deal with all the problems, but just to act like there are no problems or any risks at all, which he didn't act like there were no risks, but I just didn't really get the best feeling about him. So I didn't really feel comfortable going forward with him. So I found another physician in the area and made an appointment with her, which the appointment wasn't until September. So this was already a few months after I started this process. I had my consultation with her, and I liked her a lot better. Her name is Dr. Courtney Paradise, and she operates out of Winnie Palmer Hospital in Orlando. So I decided to go with her, and I'll talk more about the consultation itself in a few minutes. But After that, the scheduling person was supposed to call me, but that was right when we had a hurricane, and so things just kind of got pushed and pushed. And eventually she finally called me and I was able to schedule. And I was offered to schedule in November, so I could have had it in November, but I decided that I wanted to wait until January so that I could, because even though this is covered by my insurance, I still have a copay, so I wanted the copay to go toward my deductible for this year since it's a few $100s, rather than at the end of last year, which wouldn't do me any good. So that's why it took me so long to actually have the procedure from the time that I started looking into it. It was just a lot of scheduling and stuff that just took a long time. So as I mentioned, I was looking at both hysterectomy and tubal ligation, which then kind of changed into salpingectomy once I actually had the consultations, and found out that actually removing the fallopian tubes is becoming much more popular as opposed to just tying them off or cauterizing them, or pinching them, or like all the different options that they have for like getting your tubes tied. I think it might be slightly more effective. I think they're both pretty much 100% effective, but the main other benefit of actually having the fallopian tubes removed is that a lot of ovarian cancer actually starts in the fallopian tubes, so by removing them, it actually reduces your risk of ovarian cancer, which is great. The procedure is done laparoscopically, which means that they basically just make some very small incisions in your belly button and a couple of places on your abdomen, and put a small camera in there, and then use the other two incisions to actually like put the tools in, and they're able to like do this all just by looking through the camera as opposed to actually opening you up and doing the surgery that way. So it's a lot less invasive, and part of the procedure is that they pump you full of CO2 gas to kind of make the whole area bigger. And so I talk about this a little bit more later, but that's basically how it works. Before I was on T, I used to daydream constantly about having hysterectomy because I absolutely hated having menstrual cycle. And now that I'm on T, I don't have a menstrual cycle, so I don't feel as motivated to have a hysterectomy, although I wanted to find out about it because I'm not 100% sure like if I'm going to be on T forever. I might go off of it at some point, and I definitely don't want to go back to having a cycle. But the problem with hysterectomy is, yes, it stops you menstruating, but if you don't have your ovaries removed at the same time, then you still have the other parts of the cycle, which for me, it's not just the actual bleeding part that is the biggest problem. I mean, that definitely was the part I didn't like, but the hormonal fluctuations throughout the month also affected my mood, like to the point of being suicidal, and migraines, and also my skin, and the like whole ovulation part of the cycle is unpleasant for me as well. And basically, I just don't want anything to do with the whole cycle. The only way to accomplish that with a hysterectomy is also to remove both ovaries, and you can't not have any sex hormones, so if I don't have any ovaries, I'm going to have to either be taking T or be taking estrogen, and so I wouldn't really be in that different a situation that I'm in right now. So I just don't really see any point, especially since I'm already 41 now, and like it's not going to be super long till I would go into menopause anyway, so it just doesn't seem like it's necessarily worth it at this point. I'm not necessarily ruling it out forever. If there's some reason to get a hysterectomy, I will do that, but just between like the benefits and the risks and stuff, it just didn't seem like it was going to be the best option for me right now. So that's actually pretty much it for the consultations. It was basically just me going in and talking to the doctors, and they did ask questions about like my medical history and my family history and stuff like that, but otherwise it was basically just talking and them explaining the procedures and me asking questions, and yeah, that was pretty much it. So fast forward a couple months from the consultation to the actual surgery, and we're going to do a little time jump here because I actually filmed all of that a couple weeks ago. About a week before the surgery, I had to go to two different pre-op appointments. The first one was at the doctor's office, and I met with a nurse there who kind of went through like what to expect pre and post-op and some instructions for me, and had me sign a bunch of stuff. And then from there, I went to a different location just down the street, which they called the pre-admission testing for the hospital. There, they went through some more forms and more instructions, some of which conflicted a little bit with the instructions from the doctor's office. That was a little bit confusing, but I figured it all out, but it was just like a little bit kind of weird that it wasn't all lined up exactly. including like the time that they told me to get there for surgery and everything. But anyway, they did blood testing there, which basically they did CBC and just like blood type testing in case I needed a transfusion or anything, which luckily I didn't. And then went through my medical history and all the supplements and medications that I take, and told me like which ones I needed to stop, which was basically just to stop all the supplements. And I was able to still take my testosterone the day before surgery. And at that appointment, they gave me a couple of things to use for preparing for surgery, one of which was surgical scrub, which is basically Hibiclens, but it's like a different brand. But it's chlorhexidine gluconate, 4% solution. And basically I had to take a shower with this the night before the surgery and the morning of the surgery. First, just like taking my normal shower with my normal soap, and then using this to scrub my entire body gently, but to clean my whole body, including using a Q-tip on my belly button, which was kind of hard to do actually because this stuff doesn't really lather, so it was kind of hard to like really clean with it, but I did my best. And then the morning of the surgery I had to do the same thing. And I also had to like sleep that night with clean sheets and clean towel, clean clothes and everything, like nothing that I had worn that day or anything. Then the next morning I had to have like everything clean again, like a new towel, etc. So it was like pretty intense as far as like the preparation. I've never had something like that before. Before my top surgery I had to clean with Hibiclens, but it wasn't quite as like strict as far as like all of that. I also of course had to take my earrings out and wear my glasses instead of contacts. And I wasn't able to use any kind of lotions or anything. I was allowed to use deodorant, so that was nice. But basically like no other products whatsoever on my hair or body or anything. Like everything just had to be clean and dry. I of course wasn't allowed to eat anything the day of surgery, but I was given this pre-surgery drink, which was 10 ounces, and I was also allowed to have 6 ounces of water, so altogether 16 ounces. And this was actually really good. It's basically like sugar water that's strawberry flavored, so it was really good. So I drank that right before we left the house because I needed to be at the hospital at about 9:30, and it takes about like 30 to 40 minutes to get there, and we needed to park and everything. So we left home at about 8:45, got to Winnie Palmer Hospital in Orlando at about 9:30 and checked in at the front desk. It's a really cool campus, by the way. And then they sent us upstairs to the 4th floor, and we had to sit in the waiting room for a few minutes, but it was probably only like maybe no more than 10 minutes, I would say, before they called me back and took me into the bathroom. And I thought they were going to do a pregnancy test because that's what I've usually had before when I've had surgeries, but they actually didn't do one, which was kind of interesting. Maybe that was like tied into the blood testing they did the week before, although I didn't get the results of that. But anyway, instead they had me do even more cleaning because I wasn't clean enough. I had never been cleaner than I was before the surgery, I swear. But they had me do basically like brush my teeth with basically Hibiclens again, the same kind of stuff, and this little foam toothbrush, and it was like all drooling out of my mouth, so it was like not very attractive, but got me all clean in my mouth. And then I also had to do this like kind of iodine mixture up my nose and kind of swirl it around, kind of like doing a COVID test, but not as deep in. It was just like in the nostril part, and do that on each side twice. So I did all that. Then I got taken to my actual little pre-op room, or like stall, whatever. I don't know what they call it. I guess it's not really a room because it's like just a section, but I don't know what they call them. Anyway, they took me there, and believe it or not, they had me do even more cleaning once I got there. They closed the curtain, of course, and left me alone and had me take off all my clothes and use wipes that were like soaked in basically Hibiclens again, so it was like the same stuff, and wipe my entire body down, not my face and like private areas, but like everywhere else, and then put on a gown. And then finally, like, they actually put me in the bed and like hooked me up to everything and got me started on the IV. They only did just like saline to begin with, and then they had the anesthesiologist come by and talk to me and make sure everything was okay as far as what he was planning to do, and like ask me a few questions. Then shortly after that, they let Jason come into the room with me and wait. And at that point, it was probably like, I don't know, I want to say it was like somewhere between 10:30 and 11 maybe. And I still didn't actually go in for surgery until 12:30, so I still had to just like wait there for an hour and a half, but at least I had Jason with me. And basically just like hung out for a while. Also, the nurse anesthetist came by. She was the one who was actually like handling everything during the surgery. The anesthesiologist basically just like got everything started and then he left to do other stuff. And so she was the one handling everything. So she talked to me, and I told her that I had previously had some nausea after anesthesia, and so she told me she would give me all the good stuff, and I'm happy to say I didn't have any nausea at all, so I guess she did a good job with that. Eventually my surgeon finished her previous surgery, and so she came by and just like asked if I had any questions, and just like, I don't know, just like checking in, and told me that we would be starting probably pretty soon. That was around 12, and maybe a little before 12. So they offered me the like sedation to start then, but I didn't really want to start until I was actually going in, so I just waited until right before that. So then shortly before 12:30, they started the sedation, which didn't like knock me out or anything. It just kind of made me a little bit calmer, I guess. I don't know, I didn't really feel a whole lot from it. But then they wheeled me into the actual surgery room and had me move onto the bed, like the operating table. There were quite a few people around then, and at that point I didn't have my glasses anymore, so I couldn't really see them very well. But they were all really nice, and I remember just like them asking me like a couple things, like just conversationally, and then they told me that they were starting the anesthesia, and basically I don't remember anything at all after that. Like they didn't have me count or anything. It was just like pretty much like that. I was out, and then I was waking up, and I woke up in recovery. I was pretty groggy at first. I've had anesthesia before where I kind of just like woke right up, and then other times where it took me quite a while to wake up. And this was, I would say, kind of maybe in between. Like I definitely like felt very tired when I woke up, and it was like I was kind of sort of half awake, and like I didn't really want to open my eyes, and I just kind of like let myself relax and like just kind of let myself keep resting. And then eventually I just did kind of like wake up and was like, not like jumping out of the bed or anything, but like I was pretty with it pretty quickly once that started. And they brought Jason back in, and then basically just like gave me some apple juice and crackers, and then checked my vitals again and unhooked me from everything, then took me to the bathroom and helped me with that, and then basically sent me on my way. So after that we came home. So I just got back from the hospital, and I'm actually doing pretty well. I'm pretty with it at this point, as hopefully you can tell. I'm definitely feeling the gas filling my abdomen and kind of making its way up. I'm feeling it actually like up here at this point a little bit. It's not as bad as I had heard that it might be. That's not to say that it won't be later, but right now it's mostly in my lower, well, kind of mid abdomen, and then up like kind of under my rib cage, and then kind of, it's not really my chest, it's kind of like up in my rib cage area, like lower rib cage, and then like up mostly on this side. It's a little bit kind of in the middle between my shoulder blades, like up around my neck, but a lot of it's like over here. And it's also possible that there's some like soreness here from just like the way that I was positioned during the surgery or something too. But my voice, I think, sounds to me like it's maybe a little scratchy from the breathing tube, but it doesn't hurt or anything. My throat doesn't hurt, and yeah, I feel pretty good. I don't have any nausea right now. Hopefully I won't, but Jason just went to get us some dinner, so hopefully I'll be able to eat that and keep it all down. And they gave me a ton of anti-nausea medication, they told me, in the IV. So hopefully that'll do its job, and yeah, I'm feeling pretty good right now. I'm definitely like still medicated at this point, so we'll see what happens after that wears off, but I have my medication that I can take if that happens. It's now been 2 days since my surgery. I am doing pretty well. Yesterday and today I have had a little bit of pain off and on around the incision sites. They feel just kind of tender. Most of the time they're okay, like if I'm just sitting there. Obviously if I touch them, they feel tender. They've gotten a little bit more bruised at this point, and so they're just kind of like, I'm just trying to avoid touching them because obviously I don't want to be doing that, but every once in a while I will like accidentally like bump against it or something, and it's just a little tender. Also when I move, when I'm just like walking around, it's pretty okay. When I get up and down or like get out of bed and stuff where I'm like doing something where I'm having to like use my core a decent amount, it hurts a little bit more. It's not like excruciating or anything, but like I can just feel it a little bit more at that point. and so I'm trying to be a little careful with that. And I'm not allowed to lift anything over 10 pounds, so I'm obviously not like doing anything too strenuous, but I'm able to, you know, get around and like make my own lunch and dinner and stuff, so it's not like I'm like incapacitated or anything. I'm definitely able to do a lot more now than I was after my top surgery. I've also had a little bit of pain kind of feeling on the inside. It's not very strong, but like I've had a little bit of like, I don't know, just kind of like a general soreness or like slightly like a crampy kind of feeling. Not as strong as like menstrual cramps or anything, but just like along those kind of lines. Just very mild, but it's just like every once in a while I can feel that something was done to me on the inside, but that's about it. It's really not that painful. And I have been taking pain medication. I took oxycodone the night after, like the night of the surgery, and yesterday morning at 7 a.m. That was the last time I took it. Since then, I've just been taking ibuprofen and Tylenol, and that seems to be fine. So I don't think I really need oxycodone anymore. It's really not that painful. I think after my top surgery, I took oxycodone off and on for like a week or two, maybe like tapering off of it. But this is just really not like that bad. So I don't feel like I really need it. But the other thing is that as part of the procedure, they basically inflate your abdomen with CO2 gas in order to like make the area bigger so they can see things and get to things more easily during the surgery. And afterward, they try to get as much of that out as they can, but they can't really get all of it out. So a lot of times people will feel like there's just gas like trapped in your body afterward, and you can actually feel it like all the way up to like your shoulder. It's pretty common to feel it in your shoulder. And the reason for that is not that the gas is actually in your shoulder. The gas doesn't actually like go through your whole body. There is like an area within your abdomen that basically like encases all your organs, and it's inside there, but it eventually gets absorbed into that and then expelled through all the various methods of gas expulsion that your body has. But it also, the gas being in there irritates the phrenic nerve, which actually like also innervates the shoulder. So it's basically like referred pain. So that's why a lot of people have shoulder pain after having this type of surgery. Not this particular procedure, but like any kind of laparoscopic procedure where gas is used. It can basically just create some referred pain just because of the nerve irritation that occurs. So I've definitely had a decent amount of that. It's not as bad as I thought it might be based on some of the things that I read and saw before the procedure. I had seen some people saying that it was like just terrible for like a whole week. They couldn't, or even longer. They just had this horrible, horrible gas. And I definitely have gas feeling still 2 days later, but it hasn't been where I'm like doubled over in pain all the time or anything. Like I've had worse gas just from food before, not frequently, but I have had like sometimes in the past, like where I've had it really bad and it was like really painful. And it's not to that level. It's mostly just that it's kind of always there, and it's like it moves around. So you can, like when you're moving around, it kind of moves around kind of like you would expect like gas bubbles to move around in something. And I don't know how much of that is the actual gas moving around, how much is like the nerve irritation, but I think it's a combination. But the gas is moving around to some degree because that's part of how you're supposed to be able to try to get it out by moving. They recommend that you take walks and things like that. And I've seen some people who did different like yoga poses and stuff. I haven't done any of that, partly because I don't want to do anything too much like using my core, and also where I'm sitting right now filming this is actually like, this is my exercise area, and I can't really like move stuff out of here. Like I'm sitting on my weight bench right now, and I would have to move that off of here to have room to do yoga, and I'm not really supposed to be lifting things, so it's just kind of like easier for me not to do that. But anyway, if you happen to see this and you are thinking about doing this and need other ideas for how to get rid of the gas, you could try some yoga poses. There are some like specific videos online, like yoga for bloating and gas kind of things. Mostly I've just been trying to kind of deal with it through just like regular movement, and I have been taking Gas X, which was recommended to me by the doctor. I've been taking it a few times a day, and I also have been taking activated charcoal because I saw that recommended by a few different people. That you have to make sure that you take that only at least 2 to 3 hours away from anything else, because the whole like point of activated charcoal basically is that it absorbs stuff and prevents your body from keeping it so it like absorbs it and like pulls it out. It does that with gas, but it also does it with medications and even like nutrients from food. So if you take it at the same time as those, then it like prevents you from absorbing them properly. So don't take them with your medication. Take them away like 2 to 3 hours is what I've usually heard, away from any other meals or medications or supplements or anything like that. So I've been taking that just like in the middle of the night, when I wake up in the middle of the night, as long as that's like been 2 to 3 hours like in either direction from when I would be taking anything or eating anything else. I've just taken a couple of capsules of that, and I don't know if it's helped or not, but it seems like it can't hurt. Speaking of waking up in the middle of the night, I haven't really been sleeping that great. I did sleep better last night than I did the first night. The first night, I had a really hard time going to sleep to begin with. I didn't fall asleep until after midnight, which I usually go to sleep at like 8 or 9, just for context there. And I don't know, like it wasn't because of the pain as much, like that was part of it. Like the gas was very uncomfortable. When I would try to sleep on my right side, that was very uncomfortable. On my left side, it became uncomfortable. Like once I was actually on my left side, then the gas kind of weirdly felt like it was more on my left side, which doesn't really make a lot of sense. It seems like it would float to the top. But anyway, like once I got to my left side, that was kind of uncomfortable. On my back, it was the least uncomfortable as far as the gas, but it's actually the most uncomfortable as far as the incisions for some reason. So I couldn't really get comfortable in any position. I eventually did sleep with a backrest pillow, which I probably should have just started out doing because I did have that recommended to me. But those are typically not really the most comfortable for me, so I was kind of trying to avoid it. But it wasn't just the discomfort from the gas itself. You know, when your mind gets kind of like all wired and you just like can't calm yourself, like you can't quiet your mind in order to relax to go to sleep. Like sometimes your body is tired, but you just can't like turn your mind off. That's kind of how it was. And it wasn't that I was like ruminating on anything like to do with the surgery or anything like that. It was just, I just couldn't like get my mind to like calm down. And I don't know if it was like the stimulation of the day or the anesthesia or maybe like the medication they use after the anesthesia to like wake you back up. Maybe some combination of those things, I don't know, but it was just like really hard to get myself to calm down. So I had a hard time with that. The other thing is that the gas has made it a little bit harder for me to breathe. Not that I can't breathe, but like, I don't know if you can tell right now, I'm like talking really fast. I feel like I'm in more of like kind of like a sympathetic dominant breathing pattern. When I try to calm myself, like breathe slowly, it's just really difficult for me to do. And at first I thought that might just be because of the gas like taking up more space in my abdomen and like messing with stuff, like messing with the pressure, which it probably like that probably is part of it. But then once I realized the thing about the phrenic nerve, it kind of makes even more sense because the phrenic nerve actually like innervates the diaphragm. So it kind of makes sense if the main nerve that controls the diaphragm is irritated, that like that would make it a little bit harder to control the diaphragm. So that's just like a conjecture on my part, but that's what I'm thinking maybe. So I am like getting more out of breath when I'm talking, and when I try to breathe slowly to calm myself, like when I'm trying to lie there to go to sleep, it's just been really hard. It's getting better, but it definitely, like the first night was very difficult. It's not like I felt like I couldn't breathe. It's not like I felt like I was like gasping for air or anything like that. It's just I'm breathing fast and it's harder to slow down my breathing, that's all. So don't get scared that like you're not going to be able to breathe or anything like that. It's just that like it makes me feel more activated, and so it's harder to relax. So that's still going on a little bit, but it is getting better, and the gas is getting better. I did take a little walk around the corner, just like for like 5 minutes. It wasn't like an exercise walk or anything. It was just like literally like walking down the driveway and like around the corner, like literally like a corner and then back. Other than that, I've been just kind of taking it easy and just trying to relax and not like do anything too strenuous or like stressful or anything. Kind of nice that this is the weekend, so that makes it even easier. But yeah, I'm just kind of like being pretty chill. They told me I might have a little bit of bleeding, just like spotting, for up to 2 weeks post-op, but I haven't had any at all. When I first woke up in recovery, I had a pad on that they had put there, and when they helped me in the bathroom, we just threw that away. It was completely clean, and I've been using a disposable pad for the last couple of days just in case, but there hasn't been anything on it at all, so I've kind of abandoned that at this point. I think that it's probably gonna stay that way, hopefully, but if I do have a little bit of spotting later, then I guess we'll see, but it doesn't seem like I'm going to. Most of my recovery after that point was pretty straightforward. I basically just kind of tapered off the pain medication after a few days and continued to have a little bit of pain here and there. And even at this point, now it's been over 2 weeks, and I still have a little bit of discomfort. I wouldn't even necessarily call it pain. It's more like kind of a dull, unpleasant feeling. Every once in a while, I just kind of get this like feeling kind of in that general area in my abdomen. It's not all the time by any means. It's just like every once in a while, it'll be like this kind of mild, I don't even want to call it burning because that sounds stronger than it is, but it's just like a feeling that I know that I had something done there, that it's healing, but it's not that bad. I had my post-op appointment a few days ago and basically just went in and had her look at my incisions and clear me to do everything again and get back to working out. And so I'm doing that now and everything feels great. And yeah, basically just like back to normal at this point, other than I still have some obvious incisions on my abdomen, but those are healing really well. And at some point I'm probably going to do a little bit of scar care on the larger incision on my abdomen. I don't feel like I really need to do much in the one in my belly button or the little tiny one, but the other one is a little puffy, and so I might do some scar care on that at some point, but I'm going to obviously wait until it completely heals before I do that. I have to say I was a little nervous about having surgery at Winnie Palmer because it's Winnie Palmer Hospital for Women and Babies, so it is like a women's hospital, and so I was kind of nervous about that. I thought I expected that I would just go in and like everybody would just misgender me the whole time and call me a woman, and that would just like I would just have to kind of deal with it. But I was kind of surprised, like nobody actually asked me my pronouns or anything, so nobody called me by they them pronouns, but they all just called me he him pretty much. So I don't know if it was like just in my chart somewhere to do that, or if like the doctor had told them or something because she knew that I'm trans. I don't know, but I was really impressed, first of all because it's pretty rare to have any medical facility or really any business or any place where the whole staff is that good about like not seeming to have a trouble with adjusting pronouns for somebody that they've never met before, but also because it's a women's hospital, so they're pretty much all day every day like dealing with women and like mostly using she her pronouns for almost all the patients that they deal with. Also, the vast majority of the staff there were all female, so like just like mentally you would think that they are so used to using she her pronouns for everybody that like it would be difficult for them to switch, but it really didn't seem to be. And not a single person there ever treated me differently or like made a big deal out of anything, or like obviously like nobody was rude or anything, but sometimes you go places and people are like trying too hard to be accommodating and it's like a little bit awkward because it's just like it feels a little othering, and there wasn't even any of that. Like it was just like totally chill. Every single person from the like check-in person at the front desk at the hospital like to like everyone on the actual surgical floor, like literally everybody was just like really nice, kind. So I felt a little bit awkward being in like the waiting room because I felt like maybe some of the other people in there were maybe looking at me weird, like wondering why I was checking in as a patient at a women's hospital. But other than that, like the entire staff was totally awesome, and I like on top of like the gender thing, like just in general, they were all just wonderful. I had somebody ask me to talk about like if there was anything that I wish I had known before having the procedure, or like wish I knew going into this process. And I've been trying to think of something, but like there really isn't anything. I feel like it was a pretty straightforward process. I kind of understood the procedure before I had it done. I think they explained it pretty well, like at my consultation and my pre-op and everything. And then I watched a couple of videos, and the videos that I watched were actually, I think only, I'm not sure if any of the videos I watched were actually people that had salpingectomies, but they had laparoscopic procedures in that general area. So it was just basically trying to find out more about like the gas and like what to expect with that. But yeah, like I didn't do a whole lot of research, but I did enough, I guess, that I like understood what to expect. I guess I felt pretty well prepared, so yeah, it was pretty straightforward. So I think that covers it. If there's anything I didn't talk about that you want me to in a future video, then of course leave a comment below, and like this video if you found it helpful, and subscribe if you want to see more of my future content. Hit the notification bell so you don't miss anything. Thank you so much for watching, and I'll see y'all next time.